up front today, we're talking about liposuction, and I want to welcome back our plastic surgeon, Dr. Elie Levine, and his dermatologist wife, Dr. Jody Levine. You guys have been in practice for how long together?
6 years.
6 years, and you have 4 kids together?
We do.
And you still love each other, right?
More and more every day.
That's the perfect answer. All right. So first we want to talk about liposuction. And Dr. Jody, tell me about what some of the misconceptions are, you think, about liposuction.
Well, lots of people think it's an easy way out. You know, just a way to lose weight. But it's really not. I think what liposuction is best for are those areas that no matter what you do, you cannot get rid of.
Right, so trouble spots, isn't that the whole idea of what we're supposed to do that for?
You eat well, you exercise, you don't, your weight is good, but there are always those spots, the hips, the thighs, the love handles, you just can't get rid of them.
Right, so that's what it's really best for. All right, so how does it work? Because liposuction's come along. You know, a lot of people think of those old big cannulas, but it's changed a lot, right?
It's changed drastically. You know, the incisions are tiny. They're 2 millimeters sometimes, at most 3 millimeters, tiny little incisions. And fat removal, that's very similar to the way it used to be, but this is where all of the technology is really set in. Because before, liposuction was about fat removal. Now it's about fat removal and skin tightening, which allows us to do so much more for body contouring. And this is where, whether you're using laser or ultrasound or radio frequency or any of the other technologies, or typically, oftentimes with my patients, a combination of those approaches allows us to get not only fat removal, but skin tightening.
Well, skin tightening is something that you do too, right, Dr. Jody? And what kind of results can people expect from that?
Well, the skin tightening that I do is on the outside of the skin. I use the SkinTyte laser, which is great. But I always preface it by telling people this is not laser liposuction, because laser liposuction will give you better results.
Right.
And it just depends on how much skin laxity you have.
Right. Do you find that when you when you do the laser liposuction, they're happy, or do they need a little extra with it?
They're typically happy with it. It's a great procedure. Virtually no downtime. They're back to work within a day or two oftentimes. And they get the skin tightening really, really nicely in addition to the fat removal.
The results that he gets from liposuction are amazing. I often think the patient's had surgery when I look at the pictures.
Right. Well, we're going to look at some pictures right now. So let's put up some before and afters, and you can explain to what we have here. Well, I love that. Look at that. I mean, there's that little crease there. Drives people crazy.
Exactly. Yes. And you know, it's typically genetic as much as weight related, and the skin tightening and fat removal is fundamental to it, but I also break up that adhesion that's causing that roll. And by smoothing out that contour, they just look better.
That's right. You can't do that on the surface. You really need to go under the skin to do that.
Right. And a lot of people get that when they just get older too, right? They don't have it when they're young necessarily.
Exactly.
All right, let's bring up the next one.
And this is someone who also, their lower back, their waistline, they didn't feel like they had really nice waistline definition. They didn't feel like they really had a nice shape. They felt like their body had gotten older looking, even though they may not have felt older. And this allows them to look youthful. And you don't even really, you don't see scars. That's the amazing thing. They're hidden completely.
That's the thing about it.
You can't get results like this from freezing fat or many of the other techniques. I mean, she has a new waistline.
Right. It's very, very dramatic. We have another one I want to bring up and show. Okay.
And this is the belly, and she was concerned with both her fatty excess as well as her poor waistline definition and lack of definition of her abdomen. And she just looks more athletic and more youthful afterwards.
Right. Okay, so Dr. Elie, tell me about in general, the recovery. You were saying next day.
Right. It's amazing. Oftentimes, if we're just talking about an isolated area, your waistline, your hips, something like that, you don't even have to go to sleep for it. You can do it completely awake. You walk out of the office. You're a little bit sore the next day, like you had a really, tough workout, but you can get back to work right away. Oftentimes even the next day. And if people do want to take a little time off, so you can do it on a Friday and go back to work on Monday. So there's virtually no downtime with a procedure like this.
Right. And there are a lot of people that say about liposuction. I want you to clear this up once and for all. You hear people say, well, they take the fat away from there, but then the fat goes to other parts of your body, so you really don't lose the fat. What is really happening, and how does that really work?
That's an important point. So if the fat is removed permanently from that area, that fat is never coming back. And if you gain a lot of weight, if you gain 30, 40, 50 pounds, well, there's going to be fat deposited somewhere. It won't be there typically, it'll be somewhere else. But if you typically maintain your weight within a 10-pound range, it's not going to cause any problems.
All right. So the idea is that if you're going to do it, it should be something that you're going to maintain and really want to take care of yourself in the future. It's not weight loss, like you said, Dr. Jody.
Right. But even with that misconception of thinking you're going to gain weight elsewhere, if you poll most liposuction patients, they're happy. Yeah. There have been studies that show they'll do it again.
Right, especially with results like that. All right, Dr. Elie, Dr. Jody, thanks so much for coming in today.
Thank you.